Hey everyone, welcome to TakeCare Health. I'm Dr. Amanda Yeager. Hope you're doing well. I am going to be touching on the topic of trauma. I recently shared with you all the film, The Wisdom of Trauma, and so I'm going to highlight that just a little bit. I'll be honest, I did find it a little difficult to summarize because there's just so much to unpack in how trauma not only affects the individual, but society at large. And how, there are, these major events that can occur, such as adverse childhood events, which you can Google that term and look at a list of items that you can perhaps rate yourself in what you've been through in your life. And then there's also, class inequality and cultural and racial oppression, and there's just so many ways to look at it. But even on an individual level, if you think about it, if trauma isn't just these major terrible things that can happen to someone, and it's more so, it could be something like having gone through something hard and not had anyone to talk to about it or to express yourself, or not feeling safe or loved or cared for or protected as a child. And so in terms of trauma, it's not exactly what has happened to us, but how we internalize what has happened to us and how we try to make sense of it and our confusion around it about why this happened to us or why someone would do something to us. And so we carry that around with us. And in the film they said trauma takes away our presence and it makes us silent. So it isolates us because we feel othered by what has happened to us and maybe that no one would understand. And it takes away our presence because it makes us have a perspective on the world because of how we're now viewing ourselves and the people around us. So, for instance, if you are having an argument with someone or you're in a relationship and something is being discussed and you're hurt by it, you may not just be considering the facts in front of you and you're really seeing it from a perspective from your past and you're not in that present moment. So that's one way how it kind of relates. And, talking about the adverse childhood events, there's research that shows that actually creates a toxic stress in one's body. Not a good positive stress or one that's manageable, such as, being in the spotlight or trying something new. This is a toxic stress that affects us on the inside, that actually creates higher risk for things like anxiety, depression, and even asthma. And so, as a naturopathic doctor, how do I think about stress and what does it influence? So, our bodies, I feel, don't have the ability to recognize, let's say, danger the same way our minds do. So, internally, our bodies are releasing cortisol, our stress hormone, even though it's just something mental going on that's affecting us. And so that which I think in society nowadays that's a very common thing that happens with ruminating and social situations and comparing ourselves and the judgment and all of these things that can give us anxiety. They're really changing our internal chemistry of what's happening. So that increased release of cortisol, in a short-term situation is a really good thing. In a long-term situation, that actually creates inflammation in the body. And so that long-term inflammation is going to therefore destruct our microbiome, so the bacteria in our gut, because there's such a strong connection between the gut-brain axis. That also causes anxiety, depression, and also sleep disturbances. And not to mention the microbiome's influence on our immune system, which is also going to become weakened. So it's a really important aspect to consider when we're talking about health and medicine and even physical ailments. In the film, they mention autoimmune conditions and how there's an increased risk or rate for women and also other minorities, certain minorities. So that in and of itself, you know, we know the root of autoimmune conditions is stress management being helpful, and you know, long-term inflammation, even low-grade inflammation. And so how do we even define autoimmune conditions? It's more plainly said, it's the body stops recognizing the self. And so I don't know about you, but that sounds like something that could have to do with trauma as well. And I think that, you know, it's really important to ask these kind of questions and be inquisitive in our investigations, not just surrounding lab results and, you know, physical symptoms that dictate a diagnosis, but also what's going on internally with us. You know, asking questions about the various relationships in our lives and at home, at work, between family members, and how that can also play a role, because what we need to do is, you know, talking about taking us out of the present moment, we need to learn how to get back into that parasympathetic mode, which is not that fight and flight that I described with the cortisol release, but more of the rest and digest. And that really brings us into the present moment in our ability to gain nourishment from the things that we're eating, for instance. And so that's what I have to say about that in general. Some more general ideas between naturopathic medicine and working with, you know, just anyone really, is that we work with the whole person. So it's that mind, body, and spiritual connection that is important in defining someone's well-being. So when I was talking about trauma and how it's mainly someone's perception and their experience of what's happened, that reminds me of another thing in naturopathic medicine, which is one of our modalities of homeopathy. It's one of my favorite tools that we learn, and it's a bit of an energetics medicine. And my job is to find the remedy that matches a symptom picture. And that symptom picture has to do with mental, emotional, and physical aspects. And so on the same token, it's not what has happened to someone, but their experience of what has happened to them. So you can have two different people that were in the same car accident, for instance, and they're wanting help with getting through the physical and mental emotional traumas of what resulted from that. And those two people most likely wouldn't have the same remedy given to them, because they're two separate people who have experienced it in two separate ways. And so I find that fascinating. That's something that I really like to work with. Another thing is acupuncture and traditional Chinese medicine. And when working with mental health, for instance, you know, I can ask the question, how does that make you feel? And if you can't answer that, how would you want to feel? And there's this concept of the Shen, which is our vitality, of our personality. It's our mind, more or less, and it's housed in the heart in Chinese medicine, which I think is very cool. And so you can think of it that way. And then there's also the other aspect of, so there's the Shen and the mind, and then it can be further broken down into another aspect of just the mental, emotional side of the body in general, in which every organ has a little piece of the pie and how it contributes. And so if someone were to say, I want to feel more comfortable in my skin, that would make me think of acupuncture points that have to do with the lung, because we're talking about the yin soul, the corporal soul, the Po. And that has, it's more of a physical sense of our spirit, more or less. And or let's say someone's struggling with their motivation or their willpower to do something, that would be more kidney. Having more pensiveness and ruminating thoughts and worry would be the spleen. So there's so many different ways to diagnose, to work with. And so it really promotes someone really coming as they are and finding a way to work with someone and meet them where they're at. And that is how I see naturopathic medicine and trauma work and being informed about this being really relatable. And so on that note, I'm going to stop talking about naturopathic medicine because I could just go on and on. But there's one more thing that I wanted to say about the film, The Wisdom of Trauma, and how to summarize it and the sentiment of it. And for me, that is embracing compassion. And it's more of a call to action for everyone watching, along with myself, to strive to kind of move away from the idea of what's wrong with someone and instead consider what's happened to someone, and exercising more patience and understanding. When connecting with someone, I find, you'll have a better connection and a deeper connection with them. And so I think that could go a long way. So I just want to say thanks for your time. I hope that what I had to say somewhat resonated with you. And if it did, you can give me a like and a subscribe if you want to see more videos on this topic and other topics of health as well. So thanks again, and take care. Till next time. Bye.